important.
And how often we should floss our teeth?
We recommend that you floss daily. Flossing daily will help keep the food from in between the teeth, which is where we see a great number of the cavities. Eating and drinking and doing things on a daily basis adds a lot of debris to the mouth, but that also can brush it off of the smooth surfaces by your cheeks and your tongue. So your cheeks and your tongue do a good job of helping you keep the other areas clean, but they also do a good job of packing food between the teeth, and that is where flossing helps. And there's really no other good way than with floss to get in between the teeth. And when you do that, you want to bring the floss gently between the teeth, work it through slowly so you don't cut the gums by snapping it through. And then you want to brush and rub the floss against the back tooth and the front tooth. Because if you just pop it through and pop it back out, you're not getting the full benefit. So you do a better job if you bring that floss all the way, pull it towards the back and rub it up and down like a washcloth on the tooth, and then bring it towards the front, rub it up and down the tooth like a washcloth before you pull it out. And that will give you a really good flossing.
Again, we're with Dr. Sara Meng. She is a dentist here in Wichita. We're going to offer free work in your teeth. This actually next week is going to be in 2 weeks.
In 2 weeks.
In 2 weeks, we're going to tell you when and the day and the time as well. So call us at 267-8855 for more information. Sensitivity and the eye teeth. Most likely those 4 teeth, they get more sensitive than other teeth. They call them the eye teeth.
The eye teeth as well as the first molars.
Why? Why not the back?
Those teeth in the mouth, they stick out further. They're more prominent, as we would call it. So when you bring your brush across, and also these first molars, when you bring the brush across there, you're really hitting that. And other factors, those teeth get the most abuse on the gum tissues.
That's why most likely they're exposed as well.
Exactly. Most likely that area as well as back here, those are the most prominent roots. So when you're brushing, especially if you have the habit of going across, you want to brush teeth the way they grow, not across. They're not meant to take forces crossways. The gums can withstand quite a bit this way, but not this way. So that's why you get a lot of recession in those particular areas.
So besides you take Sensodyne as a toothpaste type for cure, still there's sometimes there's a medical treatment where they, I think I call it knock the teeth. I don't know what you call it.
Yes, we call it desensitizing.
Okay.
We normally start with a conservative recommendation of an over-the-counter desensitizing toothpaste. Then if we're noticing decay in the mouth, we may go to a prescription strength fluoride toothpaste for desensitizing still at home, which is still pretty conservative. Then if a patient is having severe sensitivity that's causing them not to be able to eat in that area, we will go ahead and recommend something in office where we put a protective coating over the tooth. And that usually helps the tooth calm down until it can cause its own natural insulation against the outside world.
Most likely we feel the sensitivity when we drink cold water.
Yes.
Most likely.
Cold is a very big stimulus, and what it's doing is it's stimulating that nerve.
How about eating lemon? Because I've had this before.
Yes.
And my doctor, the dentist, said, don't eat lemon.
Yes, it's high in acid. And acidic foods can cause recession, and they can also cause chemical erosion of the teeth.
Is that right?
And we don't want to have too much of that going on, because it can cause problems like part of the tooth wearing away prematurely, or it can cause excess sensitivity.
Good. What about prevention? We'll talk about decay and prevention, cavity and so forth. How can we advise mainly kids who eat a lot of chocolate actually? Yes.
And cavities don't always come just from people with sweet teeth, sweet tooth, or whatever you want to discuss it as. It's people who snack and have food sitting on their teeth. It's also, we see it a lot with people who drink a lot of juice or pop. But it's not just the sugary things, it's also pretzels and cheese and other foods that sit on the teeth and stay there for the entire time. So those are things to watch out for. We really strongly advise, there's something called baby bottle decay, and that's an important thing to discuss. Children are not meant to have food on their teeth continually. Sometimes people will put a baby to bed with a bottle in their mouth, and we strongly discourage that. If at all, the bottle should have water in it. Because if you put milk or juice or anything that is not just plain water in a bottle, it will decay the teeth. And you will see children, babies even, who have their front teeth completely rotted off, and that's a sign that they have been sitting with milk or another substance other than water on their teeth for long periods of time.
I'm sure there is a relationship between cavities and sugar
Yes.
and sweets and maybe even sodas. How soon should we brush our teeth after we eat something sweet? Is it 5, 10, 15, 20 minutes? I don't know.
I think that if you can't get to a toothbrush, you should at least rinse your mouth out with water to try to decrease the amount of sugar, and because the sugar basically feeds the bacteria.
Sure.
And the bacteria create acid. So that's what the whole process is. Acid in your mouth is not a good thing. So anything that we can feed those bacteria that's going to help them produce more acid is going to create more cavities. So the whole idea is to try to get that food away from the bacteria as soon as possible and keep the number of bacteria low in our mouth. That's